this rubrics is presented by our MasterTrack directors, and we would come up with this is we listen to the instructors, and when we listen to instructors, we look for certain things that fall into certain categories that may be major or may be minor. And so when we go through these things, we have to be very specific of what the instructor has given us that will allow you to present on. Just because the instructor presents maybe a 310 surgical code doesn't mean it includes all 310 surgical codes. For instance, if you look down through here, we have code 180, and it specifies in code 180, this is what the instructor talked about: occlusal function concepts, occlusal dysfunction, occlusal therapy. And so if you come back and do a presentation and it does not have that particular section of the occlusal code in there, we cannot give you credit for that. So if you're doing occlusion and they're doing occlusal adjustments or splint or something like that, it may not be permissible to present it and get credit for it. So we come up with these occlusion credits and everything we have by what the presenter does. We don't just come up and come our little magical box and say this is what code we're looking for. So when we do this, we go to this particular article, and so we look at, let's say 310. So if we look at 310 here and we put major code 310 oral maxillofacial surgery, and the instructor only talks about biopsies, I can't give you credit for exodontia or anything else in 310. So it's very, very important when you do your presentations is try to present your presentations in what the rubrics has, not what's in this code procedure. Because if an instructor only goes over biopsies, that's all I want to see in your presentations. And that's what we want to make sure of. So the rubrics is very, very important for you to formulate and give information that is essential to your presentation, to what that instructor did the time before the presentation you give for the following session we have. So it's very, very important that you watch that. It says Harol MasterTrack. So anyway, what we like to see when you do this thing, and pretty much every one of y'all did this, you go through, you put on who you are and what codes you want to present. This allows us as directors to watch and monitor what you're giving and make sure the codes that you're requesting is being satisfied in your presentation. So it's very, very important to have this screen there. The next thing I like, as I said a while ago, I want to know if something makes you personal. In this presentation, I've introduced myself, my wife, my son, and so it gives me a little connection to who you are and what you are. Some of these people had, scuba diving. I saw today, like he had that, we were doing with the whale shark. Some of them are hiking, some of them show their pets, some of them show their offices. Anything that we can connect with you and know who you are, it gives us something to remember. So the next thing that we like to have is we like to know who you are as well as, I like hiking or whatever it may be. This is more that personal stuff, and it allows us to know who you are. So definitely put that in there for it. So the next thing we want to do when you start going through this, we want to break down what codes you're requesting. So in this particular one, I'm requesting removal of prosthodontics. And so that allows me, the director, to sit here and monitor you a little closer if removal prosthodontics is in there. If removal prosthodontics is my subject code and all I have is implants, then there's going to be an issue. So make sure what you're presenting after this particular guide has something to do with that particular code, okay? And so when I go through after a code, I'll start doing some basic information leading into what I'm going to do, some information. You can see just different rules. It allows me to get to where I'm going with my patient. So then I introduce my patient, and my patient, I want to know about it. Yeah, it says right here, 68-year-old male who has this. It gives me information. Most of y'all did that today, and it's very, very important to do that. It gives us some information that we can monitor and watch to see what's going to happen on it, okay? So we give pictures. I like a lot of pictures because if you're doing cases for implants or like today biopsies or something like that, it gives us a bit more information on what you're doing and what you're starting from and where you're going. So this is my initial pictures. And I give pictures across the board, a full picture. I mean, I got occlusals, I got laterals, I got everything. And just like if I'm presenting a case to at the dental school to receive some kind of degree. I want to make sure you understand where I'm coming from and what I'm doing. So I'll go through all my pictures and do this. Radiographs are very important. If you have a biopsy or if you have something that requires perio, pano or full mouth or series is very, very important. It's part of the case. It's part of the presentation you want to give. It includes all the information you need and validarizes your case presentation. Then I go through it. You can use these little things to enhance things, and some of y'all did that today, but try to give entire presentations exactly what you did. As you see here, I went through the entire steps. I documented the entire steps, what I did, when I did, how I did it, et cetera, et cetera, et cetera. So it's very, very important that you continue these presentations from start to finish as much as you can. I know some are referred out, some of you can't get pictures of, but the more accreditation, the better it looks for you. So going that way. And then I use all the instrumentation, which most of y'all did today, what I did, what I used, et cetera, et cetera. Go that way. The other thing we want to see in there is the materials which you use on this particular one. Some of y'all, most of y'all today had great presentations on materials, and it was a lot better than what I did when I did my MasterTrack, but some of it was there. So we want to make sure it's in there. The other thing we want to have is references. Majority of y'all had references in there. If you use a reference and you've used a book or something, make sure you put it in there. So if somebody wants to do your presentation, they can call and say, hey, you mentioned a book, or you mentioned an article, or you mentioned some kind of procedure that was in, where can I find it? And you can refer them to that. So it's very, very important that you add that. The most important thing you have to have is medical health histories, the consents, and all those should be in there. You should always have those. We have to have those in your presentations. So be sure and always have those in there. That's a must for us to have. So looking back, let me see. So looking back, go down through mine. This tells them who it is, what it is, all the histories and stuff, the pictures, the before and afters, the laterals, occlusals, all that kind of stuff. And then I do a short narrative and what it is. I document what he was going there for, and all this stuff is in my presentation. So when you get done, listen to me talk and seeing my presentation, you can pretty much almost feel like you were there. And that's what we want to see. We want to see that kind of stuff. So that's where I'm at, and that's what we like to see, and that's what we want to see. Some of the stuff we have to see. We have to see your consents. We need to see your photos. We definitely need to see your patient's information, health histories. Those have to be in there. Okay.